Yeah. Hello and welcome to Seven Sentinels. This is Grand Master Class, and I'm Peter Simon with you. Today we are conducting speaking and writing sessions, and here we have with us Dr. Alinda Manandhar preparing for medicine specific OET, and this is a speaking role play session. Yes, Alinda, once you are ready, you can start.
Yes, I'm ready.
Go
Hi,
ahead.
Samuel.
Hello, doctor.
Hi, Samuel. So I understand today you've come here regarding your blood test results. Yeah, am I right?
Yes, of course, doctor.
Okay, so let me discuss the results with you at first. So I can see that your blood glucose level done last time is equal to 7.6 millimole per liter, and so the blood test done previously was also 7.6 millimole per liter. So unfortunately, which confirms that you have a condition called as diabetes mellitus type 2.
Doctor,
Mm-hmm.
I am little bit worried. I want a clarification of
Mm-hmm.
diabetes mellitus. I want to ask
Sure.
you, yeah, I
Mm-hmm.
have heard of diabetes, but I'm not quite
Mm-hmm.
sure. Is that the same as sugar diabetes?
Yeah, I can understand where you are coming from, and your concerns are totally valid. So let me explain a little bit about diabetes mellitus to you first, and then we'll go on further. So, diabetes mellitus type 2 is a condition where your body is not utilizing a hormone called as insulin, which which it normally does, and because of which the blood sugar level in your body is not utilized as it should be. So there is accumulation of blood glucose in your body, which causes this condition. And regarding your concern, sugar diabetes, you don't get diabetes when if you eat sugar. Are you getting me?
Yeah, okay. And
Mm-hmm.
uh, and one more thing, I want to
Mm-hmm.
tell you clearly that
Mm-hmm.
I'm not convinced of the diagnosis. Okay,
Mm-hmm.
could that be right? Because I don't eat sugar or anything. I only did the two tests. Can you
Mm-hmm.
be
Mm-hmm.
sure?
Mm-hmm. 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 Totally. I understand where you are coming from. So let me explain. So this diagnosis is based upon the research done by WHO, and the blood tests were done on two occasions on two different times. So it's the results are totally valid. You don't need to worry about anything at all. And yeah, unfortunately, it's true that you've got diabetes mellitus. Are you getting me? Are we on the
Yeah,
same page at all?
okay, but
Mm-hmm.
I want to tell you, I don't believe the diagnosis. I am not very
Mm-hmm.
much ready to comment on your recommendations
Mm-hmm.
regarding the
Mm-hmm.
management plan or what to do, and I don't think I'm going to do them.
Okay. Uh, these results are based on research, authentic research done by WHO. So, it's totally valid, and further tests are not needed at the moment. What we have instead to do is we have to start the medications right away to prevent complications of diabetes. Do you understand?
Um, yeah, I understand, but why don't
Mhm.
you try some more tests? I demand you to do one or two more tests, at least to make me pleased. You can go ahead with these tests, right?
Uh, well, it's the tests are, I totally understand where you are coming from, and your concerns are highly appreciated. But the tests are not recommended at all because these are based on researches, it's authentic. We've been I've dealt with these conditions multiple times. I've seen these conditions, such conditions multiple times, and I've been giving them medications, and we are managing them well. So there's no doubt regarding the blood test results at all. And at this point of time, no further blood tests are recommended.
Okay. So you are a doctor, you know it better, but I am not very much convinced. But what to do? I have no other option to go but to go with you. Okay, doctor, then let us go ahead. Tell me, what am I supposed to do now?
So I'll start you on anti-diabetic medications right away. And to prevent further complications, we have to monitor your blood glucose every month or so. And we'll also have to do regular blood check, or sorry, regular check of your blood pressure, cholesterol, things like that, to prevent any complications like, blockage of the blood vessels of the heart, brain, and feet, and also to prevent complications with kidneys and eyes, to make sure that your kidneys are functioning well and your vision is perfectly right. And I will also refer you to a dietitian who will better be able to tell you what to eat and what not to eat to control the blood glucose level. At the same time, I'll also be referring you to a diabetes educator. And by commencing the treatment right away, we can prevent further complications that might interfere with, yeah, we need to commence the treatment right away.
Thank you very much, doctor.
No problem at all. And to summarize, so you've got something called as diabetes mellitus type 2, and I'm going to start the medications right away. And I will be arranging you a follow-up next month to see your blood glucose levels and also your cholesterol level. And I'll be checking your blood pressure next time. And at the same time today, I'll be referring you to a dietitian. And in such way, we can prevent further complications with diabetes. Is that all right?
Yeah, thank you very much, doctor.
No problem at all.
Yeah. So now we are coming to the feedback part. Yeah. Right.
I always find it difficult to convince a difficult patient.
Yes. I'm training you. Last time I gave you one. Now I'm going to give you another one. Right. So when this patient is asking, yeah, you are doing very well, except you are a bit in a bit of panic, especially when the patient is reluctant or adamant or not ready to follow your suggestions. He's questioning you. You are little in panic. You do not know how to handle the situation, and it's a tough job for you. Yeah, come on, unmute, start your video 1 second again. Try.
Let me
Yeah,
see.
we are into the difficult topic now. So now you can, yeah, 1 second. Yes, now you can tell me, yeah, remove it. Now you can ask your question. What is your problem that you're facing? Come on.
So I find it difficult to deal with a
Convince.
difficult or patient or reluctant patient.
Okay. So why? What makes you feel, that it's difficult for you? You're a doctor. You have a
Mm-hmm.
lot of experience, and
Mm-hmm.
you have knowledge, you have subject, you have language, everything is there. What is really making you panic?
I don't know.
Yeah, you don't even know that. Yeah, fine, right, that's it. I'm going to tell you now. I am going to tell you now. Okay, so yes, right. The first thing is, you are not mentally ready to deal with such patients, because you in reality you might have seen, but handling, I told you, it's very diplomatic way of dealing with the things.
Mm-hmm.
You have multiple options, but you have limited options. That is what it is. You're not trying on multiple options. See, for example, I am a teacher. I have multiple options and I use those multiple options, but you have multiple options, but you are not aware of those multiple options also. So how will you use them? That is the difficult part. If you are aware and you know them, then you can use it. You can practice and use it. But that's the point. So here you can tell like this: you have caught the point but did not catch its a note. You did not make it perfection. That's the point. So first thing is, you said according to the standards of the United, what is that you told?
World Health Organization.
World Health Organization. Yeah. So this point you could not, strike it hard. Just named it, that's all. But you could not use its power. The standard regulations, the stipulated regulations, okay, according to the standard terms of the World Health Organization, two standard tests at on two different occasions are substantially enough to assess the condition of the patient, whether he is positive or not, especially with regard to diabetes mellitus. And there is no need of any additional single test even. This is universally accepted. And the same regulations are followed by each and every hospital, not only the hospitals, but also the doctors. And on the same note, I strongly believe that in your condition, there is no need for any additional tests. It's perfectly clear that you are positive for diabetes mellitus. You are tested positive for diabetes mellitus, whether you agree or not, whether I agree or not. The results confirm diabetes mellitus. And there is no denying the fact. It's already on the video. You can write it afterwards. No problem. Focus on this. It's already on the video. Afterwards, you can revisit the video and you can write each and every word. Right. So, see how diplomatically and without rejecting him, without refusing him, you are imposing a standard law based. So I am not anything wrong. I am not against you, but I will be ready to do any number of tests. But what is the use? So doing multiple tests are not going to give any different result. There is no denying the fact, but alternatively accepting the condition and following the treatment action plan would be definitely beneficial for managing your diabetes. Instead of going for further tests, which undeniably are not going to be any benefit. Rather than that, accepting the condition as it is on the standard test, because they have already confirmed positive, going for the recommended treatment plan, such as diabetes medication, diabetes diet, and regular physical exercise, would definitely help you. They'll definitely not reverse the condition and bring back to normal, but you can manage the condition effectively. Is that clear now? So this is the way he's telling. I don't believe. He's actually trying to hit you, but you are not strong enough. The WHO is strong enough. WHO is strong enough. You are just a doctor. He will say, another doctor, I will go. But WHO is beyond everyone, beyond him and beyond you and beyond everyone. Okay, he's just criticizing you, saying that this is not enough. I don't believe. So you can also say, you can also try some other doctors again without telling them, but telling that you have already taken. If you tell them that you have already tested 2 times positive, they will say they also will say the same thing. You can even go without telling to somebody else and says, check twice again. There will not be any difference. So better accept the fact and adapt the changes recommended for you and implement. Be compliant with your medication and diet and exercise, and everything will be normal as any other individual is. You can manage your condition. Only the difference is you are taking insulin or medication. Is that clear now?
Yes, sir.
So this is the way how you have to. Okay. Of
Yeah,
course,
totally.
it is not. It's not recommended. Further tests are not recommended. Even if I oblige to your request and send you for test, the results will be the same, and there will not be any reversal in the condition. First test is to reveal the doubts, and then second test is to confirm the diagnosis, and it is already confirmed, and there is no reversal to the process. So whether you agree or not, the condition is the fact. The fact of the matter is diabetes mellitus is confirmed. There is no question of ruling out. Okay. So, being a doctor and knowing your condition very well, and after having your test reports, I sincerely suggest you to follow the action plan provided to you to manage the condition effectively and lead a normal life throughout. Any doctor will tell you the same. There will not be any change if you go to another doctor or if you go for further tests. The result is the same. It is established. Okay. So this is the way how you can talk. Is that clear? So now, yeah, now you can share your experience. Yeah. So you have got a problem with the video again. Okay, no problem. You can share your experience then. Yes, come on. Hello? Your voice also is breaking, man. Sorry. Are you there? Yeah. Neither your audio nor your video is working. It's okay then. So let's call it a close. And then, so that's the end of the session. Yeah, you are there. Okay, fine. Now, yes. Come on.
It says your
You can share
internet
your
connection is
experience.
unstable.
Yeah, no problem. You can share your experience.
So yes, sir, I find it difficult to deal with the reluctant patients, and by saying what you, following what you said, it makes me easier to deal with such patients and negotiate with such patients. See.
That's fine. So thank you.
Thank you, sir.